Professor. My name is Brianna, and I will be presenting to you Chapter 9, Personality, and how this chapter relates to my career choice in my future. So, my career choice in my future is social work. I don't know in particular if I want to continue working in the mental health field or if I want to go into medical social work. But I'm going to be using this chapter as if I was continuing going into the mental health field. So, the reason why this chapter correlates to an individual's personality, especially in mental health, is because using Erikson's theory and the 8 stages in particular, the first stage, which is trust and mistrust, this specific aspect does use the first 2 years of an individual's life, and usually those 2 years can be a crucial moment. It is where a child normally is starting to learn how to trust somebody. For example, a parent, if the child is seeing that the parent is coming in and out of their lives, they can start having that trust and mistrust. Fast forwarding to an adulthood, that person might have some sort of behavioral problems, some trusting problems. That person might be going through some sort of mental health disorder. So I do see that correlation in particular does relate to an individual and their personality. And then also using the last one, which is the ego. I do have a little cheat sheet here, but using the last one, which is the ego versus despair, which occurs in the last years of an individual's life. From the reading, it does see that this is a point where someone who knows that their final days are coming to some sort of end, whether if that person's sick or just old age. That's usually the time where someone can reevaluate their lives and review how their lives was. So kind of just making sure that their life in general was satisfied, if meaning that they hit all their important aspects or important factors. Usually this can be beneficial for an individual in an older age. Even in the mental health field, we do get a lot of individuals over the age of 60 who can go into a psychiatric hospital because they do feel depressed, they do have anxiety. Bipolar can be an issue too, but as well as Alzheimer's and dementia. So usually during those years, an individual might be going through some sort of point because that their life wasn't satisfying, or they're coming to a point where, oh my god, was my life the way I wanted it to be? So this is where Erikson also sees that, okay, so that person is coming to their last few years in life. How was my life? An important aspect that I found using Erikson's theory is using how he focuses on from the moment someone's conceived to the moment that they die. I do believe that using this theory in particular can pinpoint back to an individual in the mental health field. For example, using the eight stages, we can pinpoint whether that person didn't meet those 8 stages growing up, and seeing, okay, well, this person did have some sort of misleading factor, and we can see that Erikson's theory did come in handy when coming into an individual. But also, aside from using this theory with patients, as an employee, as somebody who works under somebody or somebody who works with my coworkers, I can see that using this theory, we can also come to see how our coworkers are. We can see how their personality traits can be a little different. So I also use that correlation, also, like, not only using it towards patients, but also using it towards my coworkers and people I will work under. I do believe that personality in general is an important factor because people will have different personality traits, whether they're open to anything, whether they're I cannot pronounce that word, but life transitions. So we can see that with patients, with coworkers. And another theory that I will be talking about also in how it correlates to my career choice is Jug's theory, Hug. I do see that him in particular, he did focus more on adulthood. So this is more in adults, and how this can be used with somebody who's also going through, how he used the example of midlife crisis and how he created a midlife crisis. So usually a midlife crisis is a point in somebody's life where they're going through some sort of challenge and they don't know how to overcome this challenge. They act a certain way where they're not acting the way they should be. For example, a 60-year-old guy, recently divorced, gets a crazy car and then gets a 20-year-old girlfriend. So we can see that also in the mental health setting. We can have a patient who comes in going through some sort of midlife crisis, and it's more of a negative factor. So somebody who's 60 and all of a sudden is depressed and not knowing why they're going through this midlife crisis. So we do have that correlation also. So we can have somebody go through a positive midlife crisis and then somebody who can go through a negative midlife crisis. Sadly, in most cases, since I do work in a psychiatric facility, people who do come in through a midlife crisis, it's mostly negative because it's usually a time where, one, they're realizing that they're getting older. Some cases they have children and their children are, moving out, having their own families. So sometimes adults kind of are stuck and they're trying to figure themselves out. So this is where personality is really important, and just going back to Erikson's theory and seeing how those 8 aspects can help an individual when they do hit a certain point in their life. But Jug did see that midlife crisis is an important and crucial period in somebody's life. So that's something that will also be beneficial and will correlate into my career of choice. A concept that I did look into and I did see interesting is the life transitions, and the personal, the personal concerns. So the 3 of them that we spoke about, which was growth, maintenance, and loss prevention. So growth happens between 20s and 30s. And then maintenance is usually between like 40s and 50s, and loss prevention is between 50s and 60s. So these 3 periods is where someone is understanding whether do they have everything during this time. During your 20s and 30s, am I growing? Am I improving as an individual? Is my personality where I want it to be? Do I have to change anything? Do my behaviors have to change? Where maintenance, it's like, okay, I'm stable, I'm okay. But in some individuals, it's not always that case. Some individuals might have to change certain behaviors, might have to change certain personality traits. And sometimes that can be a little tense and a little unease because some people may grow up to be who they are, and that can be a challenge for them. And then loss prevention usually happens between 50s and 60s. So this could go back to somebody who's going through some sort of midlife crisis and understanding like, oh no, like this is what's happening. I have to understand that this is how it can work. So understanding that this is what occurs, this is what's going to happen, and we have to move on from there. In some cases, it might not be that way. In my career choice, it's kind of redirecting and letting that individual know it's okay, this is what happens, and this is how life can be. But in some instances, in some cases, some people don't have that mentality or they don't have that education. So this is why this important chapter is really important in my career choice. Going back and plugging everything together with the 2 theories, with these concepts, it's important to know that someone's personality can be beneficial or it can be a drastic change to somebody in the mental health aspect. So somebody who's struggling with a certain disorder, whether it can be a personality disorder, we can go back and see where these concepts may land and how these concepts can either hit them, how it can make it or break them. So this important chapter is really, really important in the mental health field. And I really hope that as I grow in the mental health field, I can go back and correlate all these concepts and these two theories that I learned and see how I can pinpoint and put things together with individuals who are struggling or who are going through difficult times, but also to those that have positive moments, how we can continue and how we can stabilize those individuals and help them grow together. I really hope you enjoyed this presentation. Thank you so much. I really learned a lot in this particular chapter, and I do know that this chapter will help me in my future career choice. Thank you.